The Ice Bucket Challenge to strike out ALS has become a popular trend on the internet. The purpose of the challenge is to spread awareness for ALS. But what exactly is ALS? ALS stands for amyotrophic lateral sclerosis and is also known as Lou Gehrig's disease. It is considered a progressive neurodegenerative disease that affects the motor neurons in the brain and the spinal cord. ALS affects either the upper motor neurons, lower motor neurons, or both. Upper motor neurons are the motor neurons in the brain, while the lower neurons are in the spinal cord. ALS affects a person's ability to voluntarily move. Normally, a movement signal would start from the brain, travel to the spinal cord, and then reach the muscles to cause a movement. By compromising either the upper motor neurons, the lower motor neurons, or both, voluntary muscle movement fails. Results of motor neuron degeneration starts with muscle weakness and twitching of the hands or feet. As the nerve cells degenerate further, a person's muscles will begin to atrophy from disuse, causing paralysis. Speech impairment and trouble swallowing and chewing can also occur, thus leading to an unhealthy drop in weight. Advanced cases of ALS can cause difficulty breathing, forcing the patient onto a ventilator. Eventually, the patient will die, usually due to respiratory failure. It's hard to say what the scariest part of ALS is. It could be the fact that life expectancy after onset of ALS symptoms usually lasts about 3 to 5 years. It could also be the fact that ALS currently has no known cure. Finally, it could be the fact that although 20% of ALS cases stem from genetics and familial causes, 80% of cases are sporadic. That means we have no idea why those 80% contracted ALS. In fact, there is no test for ALS. Diagnosis of ALS usually depends on observing the symptoms and ruling out every other possibility. This also makes preventative care very limited because we have no idea what we should be preventing. One promising theory, however, could be glutamate excitotoxicity. Glutamate is a neurotransmitter dealing with excitatory signals. A healthy nerve cell will have some glutamate build up around the cell so it's available if needed. One type of glutamate excitotoxicity involves the overbuildup of glutamate, causing a nerve cell to fire constantly. After a while, the nerve cell will begin to degenerate and eventually die. So far, the only FDA-approved drug for ALS treatment is Riluzole. It works by reducing glutamate buildup and has shown to moderately extend life expectancy. Even still, there are 5,600 new cases of ALS every year, and about 30,000 cases nationwide at any given point. With no known cure, it's one of the most lethal diseases out there. The reason you are dumping ice water on yourself is to raise awareness for a disease that we know depressingly little about compared to other diseases. Donations for ALS fund research on a multitude of fronts. Together, we can help uncover the causes of ALS, develop better treatments for ALS, and, eventually, we can find a cure and strike out ALS once and for all.